Now, some knee and hip pictures. This is a healthy knee and a healthy hip. And when you look at these photos, you can see this white section here. That's a representation of cartilage. You also see it here. And what happens when you're in need of having joint replacement surgery, this nice white shiny portion is wearing out. And it wears out irregularly. And what happens, and you'll see this in the next, is over in here, you see these beige areas here. You see some beige areas here. That's where that nice white shiny cartilage has worn out, and that's actually exposed bone. That's what's causing you the pain. In this picture, this is the replacement. This is the femoral component. This is a plastic spacer, and then there's a tibial component. So here are some better pictures. These are actually the x-rays of a total knee after surgery. This is the front view. So here is the femoral and the tibial. And then this is a side view. And the reason why I like the side view here is because it shows this piece right up in here shows how it anchors into the femoral bone. This piece shows how it goes down into the tibia. And then here with the hip, there's actually a number of components in the hip. This is the stem of the femur. You have your femoral head here. This is a plastic lining. And then you have your acetabular component. And all of this fits nicely into the pelvic area. So with that being said, what you need to understand is before we can put the prosthesis onto the knee or the hip, a thin layer of bone has to be removed so that we have a nice smooth surface. If we didn't smooth out that bone, what would happen is you would get a loose fit. And pretty soon that prosthesis would not be worth very much to you. So that's a brief, very brief statement about how the surgery takes place. I just want to mention the overall surgery time can be anywhere from 1.5 hours to 2 hours. I know when your family is waiting, they're always saying, "Are they done yet? Are they done yet?" And I just want them to keep in mind the physician really needs to be very attentive to every single detail. And if it takes them a little bit longer, then so be it. Now for pain management, we use the pain rating scale. 0 is no pain. 10 is the worst possible pain ever. And the reason we have you use a pain scale with numbers is because we can have you use words and it's just not going to be the same thing. So if I was getting ready to have knee surgery and I had just finished walking in from the parking lot and you asked me how my pain was and I said, awful, my pain's awful. And I took some pain medicine, about a half an hour, you ask me again, and I say, my pain is terrible. Well, where is awful in relation to terrible? And that's why we have you use a number. So if I say, walking in from the parking lot, my pain was a 7. Then I got pain medicine, my pain's a 4. Did we make progress? Certainly. We went from a 7 to a 4. That's one of the reasons why we have you use the numbers. Please do not report your pain as a number 10 all of the time unless it truly is a number 10. I had a patient, actually I've had a couple of patients say to me, oh, I tell them it's a 10 so I get the good stuff. Well, the good stuff is whatever pain medicine works best for you. You and I, your family, we could all take the exact same pain pill for the exact same number of pain and have totally different reactions. I personally don't handle pain medicine very well, so I would be this one sound asleep in the corner. Somebody else would say, oh, you gave me that pain pill, it didn't do much to alleviate my pain. So it's important that you establish a good rapport with your nurse by communicating honestly what your pain level is so we can treat it accordingly. Okay, now when to ask for your pain medicine. You need to ask for your pain medicine when you notice the pain in your knee or in your hip is slightly more than what you had. Because some people will say, well, my knee always hurts me. Okay? When you notice it bothering you a little bit more, just ask for pain medicine. Don't try and figure out if you're eligible for pain medicine. Don't try and figure out when was the last time you had that. We record all of that, keep track of it. And the reason why I say just ask for it is because if you're asking for pain medicine, and maybe it's like 15 minutes too soon, we'll see if you can hold off for that little bit of time. We'll make you as comfortable as possible. And then we'll medicate you as soon as we can. But if you're asking for pain medicine and it's really too soon, that's going to tell us what we gave you the last time is not the best choice. Maybe we need to increase the dose, or maybe we need to change you out to something else entirely. So keep that in mind. Now, around-the-clock pain medicine is just that. Some of our orthopedic surgeons are ordering for patients to definitely get pain medicine at certain times of the day. And this is different than asking for pain medicine as needed, or what's called PRN. PRN means the patient will say, no, I don't need pain medicine right now. Or the patient says, yes, I need pain medicine. Around the clock, the patient is definitely going to get it at set times. It's kind of like if you have to take a blood pressure medicine in the morning and then you have to take one in the evening. Those are around the clock blood pressure medicines, and pain medicine can be ordered accordingly with that. Big side effects of pain medicine. First one is constipation. So for that, your doctors will order a stool softener for you. And usually we have you taking the stool softener twice a day. Some people report lightheadedness, dizziness. If you feel that way, please communicate that to the nursing staff. But I also want you to keep in mind, most patients have some degree of lightheadedness and dizziness, especially the first day after surgery, simply because you had surgery. Another side effect of pain medicine can be some nausea. If you feel that way, please let the nursing staff know. I also encourage patients to take their pain medicine with a little bit of food. We always have some crackers, some juice, some milk, things like that on the floor. You can also order something that doesn't require refrigeration when you order your meals. Maybe a piece of fruit, a muffin, something like that. Keep that in your room for when you are taking pain medicine during the middle of the night. Multimodal pain medicine means it's not just the narcotics. It's a couple of other things. Anti-inflammatory medicines, which help decrease the amount of swelling in the knee or in the hip. And when you decrease swelling, you decrease the level of pain. The less pain, less swelling, happier you're going to be. Cryotherapy is just using ice on your surgical site to help minimize swelling. Again, less swelling, less pain. And then doing the exercises, and that sounds kind of bizarre, that doing the exercises will actually help decrease the amount of pain you have. But if you kept your hand or your leg in the exact same position for a long period of time, it would get stiff, it would get swollen, and it would be harder for you to do what you really need to do. So doing some of the exercises that physical therapy will direct you to do will help keep mobility and decrease the amount of pain. Medications from home. Most of the time, we tell people not to bring their medications here to the hospital because we have a pharmacy. That pharmacy can supply all of the medications you need while you're here in the hospital. However, in some rare occasions, there's a medication that we do not carry here in the hospital. And in that scenario, we will ask your family member to bring the medication in from home in the original bottle. When they do that, we'll send it to pharmacy to make sure what's in the bottle is actually what's printed on the label. We'll identify it as yours. We'll send it back to the nursing unit, and then that will be kept in a special location, and the medication will be dispensed from that bottle by the nurse. When it's time for you to go home, we will return that bottle of medication to you. Never ever take any medication while you're in the hospital unless the nurse gives it to you. And the reason for that is we may already have that medication ordered. And just a very quick story, there was a very sweet elderly lady who asked her family member to please give her her cosmetic bag. And the family members wanted to be good family members, so they did that. The next day, the next morning, when she woke up, she asked the nurse if she could have her cosmetic bag so she could brush her hair and put a little bit of lipstick on. Nurse said, sure, fine, no problem. Well, in the cosmetic bag was her thyroid medicine, and her usual routine was to comb her hair, put her lipstick on, take her thyroid medicine. So that's what she did. A few minutes later, the nurse came in and said, I have your thyroid medicine. Patient said, no, I don't need it. And the nurse said, well, the doctor ordered it. You take thyroid medicine every day. And she goes, oh, yeah, I do. She says, I already took it. Now, if that conversation had not happened, that patient would have been overdosed on her thyroid medicine. So please do not take any medication unless the nurse is the one who gives it to you. Anticoagulants, it's another name for a blood thinner. Some of the anticoagulants you may be familiar with would be Coumadin, Plavix, and then the one we tend to use a lot is Lovenox. The reason we put you on a blood thinner is to decrease your chance of getting a blood clot. Very simply put, a blood clot is something bad. You don't want one. So we're going to thin your blood a little bit after surgery to decrease that risk of a clot. Most of the time, you're going to be on the medicine called Lovenox, which is given in shot form into your belly or your upper thigh. And the shot is with a very thin, short needle. If you're going directly home, we will instruct you using one of these Lovenox kits on how to do your own injection. It is not particularly difficult to do the Lovenox injections, but if you're squeamish about giving yourself an injection, we can certainly instruct your family member. Most of our patients are on Lovenox for only a period of a couple of weeks, and then usually the doctors will take them off of their blood thinners entirely, or they will put them on their aspirin, or if people were taking Plavix, they may start them back on their Plavix at that point. So your doctor will make the decision based on your medical history. Certain blood thinners require blood work. How long you're on the anticoagulants is determined by your orthopedic surgeon. The big side effects with anticoagulants, bruising is a big one. So if you happen to bump into a piece of furniture when you're up navigating with your walker, you're going to notice a bruise. Most of the time, bruising is not an area of concern unless the bruise starts out maybe around this big, and then a half an hour later, it's this big. That is something very abnormal that would need to be reported to the medical personnel. Other side effects that you would need to report would be heavy nosebleeds, coughing up blood in your urine, or in your bowel movement. Those are all very abnormal side effects, and they would definitely need to be reported to the nursing staff. Food and fluids. We start an IV when you first come into the hospital, and we keep that IV fluid running until we're sure you're able to take and tolerate fluids and food. Once you're able to tolerate your food and fluids, the IV needle will stay in place, but it will be shortened up to what we call a saline lock or a heparin trap. And we leave the needle in, so if there's any additional medicine we need to give you through that IV, we don't have to chase you down the hallway to stick you again to start an IV. Your meals. Your meals can be as simple or as hearty as you would like, but I encourage patients to go simple initially, at least for the first couple of meals, because many of our patients will say, oh, I'm starving, and they eat this huge meal, and 10 minutes later they're throwing it up. So use good judgment when you're ordering your meals.